Has the medical community shifted to undertreating pain now? Hi, my name is Dr. Moidani, Weight Loss Doc MD. I'm a primary care doc who helps his patients lose weight and live healthier lives. But my day job, or my night job, is that I'm an admitting hospitalist. I want to talk to you about a couple cases where I thought, hey, are we undertreating these patients' pain? So sometimes, or often, I admit a lot of patients with debility. Most of my patients who I admit in the hospital are like 60, 70, 80 years old. Their muscles are wasting, they're feeling weak, they're catching diseases due to age and just overall deconditioning of their body. So I tell them, hey, to prevent future falls, you really got to build up lower extremity muscles more. You got to stay active. You got to build lean tissue, lean muscle tissue, and so much more lifestyle things to make sure they don't end up in the hospital and seeing me again. But recently, I've been noticing more and more patients tell me that, Doc, I simply can't because my back hurts too much, or my hip hurts too much, or my knees. By the time you're 70 or 80, you're dealing with osteoarthritis in a lot of your joints. You're dealing with degenerative discs in your back, and you'll be lucky if you're walking around without any issues, because health issues catch up to all of us ultimately. The first case that comes to mind over the last few days told me that their doc decreased their dose of Percocet and opioid medication. And while they were on that old dose, they were active, doing everything in their life as normally as possible with a bad back. They were exercising, going out running errands, etc. But after their dose was reduced by half, they can't get around anymore because of their back pain. They're no longer active, they're no longer working out, they're no longer interactive with other people. And these are the activities that keeps them sharp mentally and their body keep on moving. But when they stop because your musculoskeletal system, your infrastructure is in pain, everything starts slowly shutting down. That means their brain and their muscles, because they're not using it, and the muscles start to waste due to lack of use. Similarly, I admitted a patient today who's really struggling with their pain and it hit a critical limit where they're not even moving around doing anything anymore. And their family tells me they've started wasting away mentally and physically because they've been so less active. They've started eating less. Less activity could mean the earlier forms of dementia, which affects your appetite. They're eating less and they're wasting weight that way, and they're also not moving, so they're losing muscle mass that way from lack of use. Both of these cases related to pain. And it made me think more. Has the pendulum swung to the other side where we're so afraid to treat pain now? Docs, medical doctors, not only regular medical doctors, but even pain management specialists, are they worried now about the repercussions of actually utilizing medication to alleviate patients' symptoms? I've heard about this from my friends who are pain doctors who are worried now that people might think they're overprescribed when they're just trying to treat patients' pain. Now I understand this was abused. Opioids have been abused in the past, but I'm also afraid we clamped down too hard and we restricted qualified doctors, good qualified doctors, from practicing medicine to help their patients. Now me, as someone who does lifestyle, obesity medicine, body optimization, anti-aging, this limits me now because I can't tell these older patients who have chronic diseases, especially chronic degenerative diseases in their musculoskeletal system, hey, you need to be more active. You need to lift more weights. You need to get more steps. You need to get out of your home and interact with others to be socially engaged. They can't do that because they're in pain. How can they maintain their muscle mass when their musculoskeletal system is in pain? So maybe we really should rethink some of it. Maybe we should have a cohesive, collaborative plan to treat some of these pains more optimally so they can continue their everyday activities of life. Continue strength training and resistance training that could potentially improve osteoarthritis in their knees and their hips. Sometimes a lot of the right physical therapy and training can actually improve the osteoarthritis in these joint spaces for them to be able to move that joint better. Knee osteoarthritis often gets better when we improve the muscles that are attaching the joint space, and it pulls. When you improve these muscles, it pulls this joint into the right place so there's less bone on bone action. Walking programs have been shown to decrease back pain. Maybe patient may need some medication just to even start the walking program. Maybe they need the pain medication to help them be more mobile and offload some of the weight that's hurting their joints even more. because decreased mobility just means they're going to waste away, both physically and mentally. Anyways, I think this is an area that needs more attention, more thought, more policy adjustments from experts, pain management experts, actual medical doctors, instead of sometimes hypersensitive lawmakers. I hope you've gotten a little bit insight into my world where I try to connect a lot of these ideas and additional thought to formulate your own about this topic. Anyways, my name is Mansoor Moidani, MD, weightloss.md. I talk about lifestyle, obesity medicine, anti-aging, body optimization. Follow for more about these topics.